As a new grad, I realized when you start working, the point of PT school is to get you to a point where you're entry level. And so you start working and you realize you kind of have more questions than answers. So that was what drove me to apply for the residency program. I realized I didn't really have everything I needed to practice at the top of my license quite yet. I was at entry level, but I wasn't quite where I wanted to be with my practice. So I wanted something to help me get to that top level, top of my license practicing. I think as a new grad, it's easy to get overwhelmed with the amount of information and trying to do your differential diagnosis and trying to figure out which road you're going to go down. So residency definitely gives you a much better framework to work off of when you're faced with those complex cases. I definitely got the opportunity to learn a lot of manual skills from different clinicians. The other big aspect of the program that was awesome was the mentorship opportunity and just seeing how different clinicians practice in their practice settings and then being able to take pieces from each clinician that I shadowed and kind of incorporate that into my practice. The entire year of residency you spend reviewing all that same content, so when it came time to sit down and really start studying, it was almost like a review of everything that we learned. Our current pass rate is 100%, which is great, so that was a big confidence boost going into the OCS. The residency program definitely teaches you a lot of skills other than just the clinical aspect. Communication skills are huge. When you're trying to provide patient education, like working through the language to use, it's something that we touch upon in school, but it definitely takes practice and trial and error to get it right when you're explaining a concept to a patient. Managing stress is definitely something that's challenging for everyone that goes through the residency program. Trying to make time for yourself is important. Keeping up with whatever physical activity you enjoy doing, getting a good amount of sleep every night, trying to stick with some sort of consistent routine. Having the support as a new grad was great because there's always, at least a couple times a week as a new grad, there's an instance where something comes up where you have a question, you want to turn to someone to ask and just kind of run your thought process by them. So having that resource was really great, and knowing I could just reach out, whether it was through Teams or even a text message. I remember during the residency that the residency director would check in on me if I had something going on, just to touch base to make sure things were good on a personal level too. When I did the residency program, I did it with 2 other residents in 2 different clinics that I hadn't been to before, so it was great to meet some clinicians from those areas that I would have not met otherwise. And we actually got really close over the year that we were in residency, so that was great. The name of our group chat was Residency Queens, so that was, we're always, do you guys want to get together? Do you want to study at this time? Can we practice this? That sort of stuff. Hey, do you guys remember what we said about this? So it was great to always be in touch and go through that together. They both actually got married in the last year, and I went to both of their weddings, so that was really fun too. And yeah, we're still in touch, and it's great to have those connections throughout the company. I have some great clinicians that I connect with in my office, but beyond just our office, having that network of clinicians that specialize in different areas. So if I have a clinical question that maybe someone in my office doesn't specialize in, there's definitely someone in the company that I can reach out to that specializes in that and can give me kind of some guidance on where to go. So looking back on it, I'm really glad I did the residency program out of school. I look at where I was when I was practicing as a new grad, and I wasn't doing anything wrong. I was treating my patients to the best of my ability, but when I look back on my treatment plans and the way that I was practicing compared to now, I'm so much further ahead than I was when I first started, so that's a really awesome feeling. The residency programs are a really great fit for anyone who's looking to go from that entry-level position that they're at with their practice to that next top level of practice. So if you're looking to practice at the top of your license, the residency program is definitely the fastest way to get there. It definitely takes someone who's motivated. You have to have good work-life balance for sure. And yeah, as long as you're willing to put in the work, it definitely will get you where you want to be. If you're interested in joining PTSMC's residency program, visit ptsmc.com to apply.